So it's Monday and the community nurse is coming. She comes every week and she does a dressing change and she flushes my line so my line doesn't clog up. And when I need a blood sample taken, when I have a blood test, she also does that. It's usually every week, but now I'm in maintenance, it might not be as much. This is my line. It has 2 lumens, and you can see where it goes into my skin here, and the tube goes all the way up here and into one of the veins in my heart around here. They had to do an incision here just so they could put the line through. But I have 2 lumens and they have 2 clamps on each of them, and both of them can be used, but the red one is a bit bigger and it does make it easier to take blood from it sometimes. Now that I am going on to maintenance, I am on the waiting list to have my line taken out, but I'm just waiting on the surgical team to get back to us about when that would be. So what happens is the community nurse takes these syringes. See, it has a little twisty thing on the end to twist it onto the line. What she does is she twists off the cap and discards it, and then she gets the syringe and she puts it in, and then she unclamps it. And then what happens is she takes some of the blood, and that first blood, that's just sitting in the line, but it's mixed with heparin, so she has to discard it. So she would then clamp the line back up and discard it in the bucket over here, my big waste bucket. And then after that, she'd get another syringe and she would take another blood sample, except this time she'd keep it and then she'd send it off to the hospital, where I will then find out what my blood results are. She gets another syringe and a screw-on needle. This needle isn't designed to go into skin, it's quite wide. It's used to take the solution out of here. So this is sodium chloride, and this is one of the things that's used to flush my line. So once she's got the solution from the bottle, it'll just suck up into here, and then what she'll do is she'll take off the cap, put it in again, and then unclamp the line, and she'll push that all the way in, and it will go all the way up here. So after she's pushed in the sodium chloride, she'll get another new syringe and she'll get the heparin, which come in glass vials, and she'll have to snap the end off here, and she'll get the needle again on the end of the syringe, and she'll get the heparin into the syringe, and then she'll just push that so it just sits in the line, so my line doesn't clog up because heparin prevents clotting. And she'll do that with both of my lumens, even though the blood sample's just taken from one of them. At the end, she will put on new end caps, and discard the old ones and put them in the bin. So my dressing needs to be changed every week so I don't get infection there. But first thing we need to do is remove the dressing to change it. So we usually use either Appeal wipes or the Appeal liquid. I prefer the Appeal liquid because the wipes are kind of hard on my skin, but the wipes are just like any normal wipes apart from it says it's a medical adhesive remover. Blah. And you just wipe that off and get all the sticky stuff, but I find it doesn't always remove all the sticky stuff and it just kind of hurts your skin. I prefer using the Appeal liquid. What happens is you just rip along here and then you take the green bit off and you see there's a tube thing and that's where the liquid comes out of, and you just drip it along here and it kind of melts all the sticky off and it usually works quite well. Then what they need to do is they get this magic stick and it has liquid in it here, and when you click those in, the liquid goes to the spongy bit, and what they do is they clean with the spongy bit, but they start at the wound site and then they go out and they don't go back into the wound site because they can drag some of the germs and stuff back in and that can cause an infection. Once that's happened, I need to get the new dressing on, so quite stiff. So this is what it looks like. Wait, no, it's this way around. And what happens is it goes like this because the line usually ends up going there, and then you have those flappy bits either side, and you see it's quite hard now. It's kind of like plasticky. What happens is this bit, once it's stuck on, it gets peeled off, so it's kind of just like this skin layer, and I usually put an S in it because it takes some of the weight off the lines so it doesn't pull down. Sometimes that can hurt at the wound site, but it has these here which help stick on, and this one is for the date so they know when the next dressing is due.